Hello to everyone that is watching. I will be arguing for the side of implementing a single-payer healthcare system. First, I would like to explain what a single-payer healthcare system is. Single-payer healthcare system is where everyone is receiving comprehensive coverage regardless of their ability to pay. The single payer would be the government. This is funded by taxes. The main arguments I have for wanting to implement a single-payer healthcare system is as follows: the simplification of the healthcare system, affordability, affordability for the population. I apologize. Cost containment, access to care, and the elimination of surprise billing. I will also add countries where this is working efficiently, or just show examples of what their single-payer healthcare system is. First thing I would like to promote is being the simplification of the current system. Currently, you have to go through several hoops just to get a checkup. You have to make sure that your doctor's covered by your insurance. And if they aren't covered by your insurance, guess what? You're paying for that out of pocket. Even if your doctor is covered by your insurance, you can still have to pay a copay for the visit. Under a true single-payer healthcare system, under a true single-payer system, as opposed to a universal healthcare system, the government would step in to replace private health insurance companies. Patients wouldn't pay premiums to a company to receive coverage, and tax dollars would go directly to healthcare providers instead of to insurance companies. From thebalance.com, which was written in October 2020. Again, a single-payer healthcare system would lead to a simpler healthcare system. With a single-payer healthcare system, costs for treatment will be little to nothing for the public. And a great example would be a great example of this being more cost efficient for the public is what the UK is doing for their people. This is a comparison of healthcare costs between the US and the UK. The cost for the ambulance in the UK is up to £300, while in the US it could cost upwards of $1,200 plus mileage. So basically, it's just a really expensive taxi. The cost to give birth to your child in the hospital in the UK could cost upwards of £3,500 versus the US, it could cost up to $30,000 or even more if there are complications. The UK is a prime example of being cheaper for the public. Next will be cost containment. And again, this example will be provided by the UK. Even though the public is still paying for their healthcare, they're getting it at a cheaper rate than in the US, who has a free market healthcare system. Cost containment is possible in a single-payer healthcare system when the government steps in and uses the tax dollars and sends it directly to the healthcare professionals, instead of sending it to insurance companies and just adding middlemen, which will increase the price for no reason. Now, access to care, which is one of the weakest points for wanting a single-payer healthcare system. One argument that I know my opponent's going to use is wait times in Canada. There are a list of ways to lower wait times, including getting patient information before the appointment, and enforcing a policy for the patient being late or not showing up. Yes, when the U.S. first switches to a single-payer system, there will be long wait times at the beginning of the transition. But again, implementing policies so that people are not getting a checkup every month and are not using all the resources. So when people are getting checkup every month, it's making the wait times longer for those who actually need it. Last thing I would like to cover is surprise billing. This is a little thing, very minor in the US. 25 states have it outlawed. The other 25 have no regulations on it. So what surprise billing is when you go to a healthcare provider that's covered by your insurance, and then while you're getting serviced, you find out that the services you received are not covered by your insurance. This is something that will not happen under a single-payer healthcare system. Again, thank you for listening to my argument.